In the following video, you will be shown how the M.4s PCL Dynamic orthosis is correctly fitted to the knee. To determine the correct size of the orthosis, please measure the circumference of the affected leg 15 centimeters above the center of the knee on the medial side. You can then select the appropriate product according to the size table. To replace the wedges, press the hinge cover out and away. Remove the tweezers from the hinge covering and, with them, pull the wedge out of the hinge. To ensure correct positioning, all wedges are labeled with the respective function and the corresponding degree setting. Always push the silver-colored wedge into the hinge from the front, and always push the black flexible wedge into the hinge from the rear. This is to make sure that the label up is the same on the hinge and on the wedge. A click will confirm that the wedge has locked. Then move the orthosis hinge and check that it is working correctly. Reattach the hinge cover. Caution: the wedges should only be replaced by orthopedic technicians or trained medical specialist personnel. Replaceable pads can be used on the interior sides. This will ensure an optimal positioning of the orthosis even in cases of very small knee circumferences or varying levels of swelling. Ensure that all belts are unfastened. It is best if you pull all belts out of the plastic eyes and close up the Velcro straps to prevent damage to clothing during application. Pull the tensioning dial out until you hear a click. Now pull the support pad out until it stops and re-lock the tensioning dial. It is best if the patient is sitting on the edge of a chair or a stool when applying the orthosis. The leg should be bent approximately 70 degrees. Now hold the injured leg at the calf and stretch the orthosis out over the knee. Position the orthosis such that the center of the hinge is located at the height of the upper edge of the kneecap. The belts should be fastened in the correct order to ensure an optimal effect and a secure fit for the orthosis. Ensure that the hinge is located behind the lateral center line of the leg, and check that the hinge is still positioned on the knee and that the orthosis has not become contorted. Ensure that the tensioning dial has been pushed back inward to activate the tensioning mechanism. The most typical sign of injury to the posterior cruciate ligament is the posterior drawer effect. This can be counteracted through active application of force to the support pad. The tibia will be brought into the correct physiological position and held there securely. Therefore, turn the wheel until the tibia has been securely stabilized. Touch the protruding tibia plateau with your thumb. It should have the same shape and feel as in a healthy leg. In a visual comparison, both ankles should be parallel to each other. The indicators on the guide bars can be used as a reference for the position of the support pad. You can achieve additional stabilization by fastening the tibia belt. This must always be the last belt to be fastened. The belt, however, is not a necessity. To be certain that the orthosis is positioned correctly, you should have the patient take a couple of steps. Once again, check for correct position and, if necessary, regulate the belt so that the orthosis is positioned securely on the leg. The pad and covers can be washed by hand with cold water and a mild cleaning agent. Let the pad and cover air dry.